This is where the erectile health begins to connect with something bigger. So what happens if these early signals are ignored or pushed aside? When we start to look over individual cases, we start to see a global pattern forming. So what is causing this decline, and why are so many men not aware of it? And this is exactly why early awareness can change outcomes. Why are more men in their 20s or 30s experiencing erectile dysfunction today? Is it just really stress or anxiety? Or is the body trying to tell us something more? What if erectile dysfunction isn't only about sexual performance, but about blood flow, nerve health, and hormonal balance? And what if these early changes are appearing long before other health problems become obvious? To answer these questions, first we need to really understand what an erection actually depends on. An erection is a reflection of vascular, neurological, and hormonal balance. The strongest predictor of erectile dysfunction is linked to the blood vessel health. The arteries supplying the penis are way smaller than the arteries supplying the heart. So any problem in the blood supply can show up here first. Even subtle changes in hormonal balance like testosterone or thyroid can affect libido, can affect erection and energy. Chronic conditions like diabetes, anxiety, stress, peripheral vascular disease can affect your blood vessels and the nerve tissues and can lead to erectile dysfunction. So erectile dysfunction is not just about sexual performance, but it shows a lot about your health. So what happens if these early signals are ignored or pushed aside? Many younger men avoid evaluation because of embarrassment or fear of judgment. They rely on temporary solutions like over-counter medications without understanding the root cause of erectile dysfunction. But when erectile dysfunction is ignored or masked, we lose an early window to diagnose serious health issues. Erectile dysfunction can reveal a lot about your hormonal health, neurological health, and vascular health that can respond a lot better if diagnosed early. It should not be seen as something to hide, but as an information the body is providing. And this is where the erectile health begins to connect with something bigger: fertility. Erectile dysfunction and fertility coexist. Conditions which can cause erectile dysfunction can also affect the fertility. Chronic conditions like diabetes, blood pressure, smoking, stress, hormonal imbalance, all of them can cause erectile dysfunction and can also impair the sperm production and the quality. Addressing erectile dysfunction not only supports your sexual health, but also in long term helps in fertility and the physical health. When erectile dysfunction appears early, it is not a reason to get panic, but it is a time to listen to your body. When we start to look over individual cases, we start to see a global pattern forming. Male fertility is declining worldwide, and this trend is already affecting the present generation. Studies in last few decades have shown a steady drop in sperm production and sperm quality across the countries and lifestyles. Unlike women, men do not have any clear signs or biological clock. Most men discover fertility issues only when the conception is delayed. So what is causing this decline, and why are so many men not aware of it? Male infertility often develops silently. One of the most important contributing factor is heat exposure. Sperm production is extremely sensitive to temperature. Long hours of sitting, laptops on the lap, tight clothing, and frequent sauna bath can worsen your scrotal temperature and affect the sperm quality. Chronic stress and poor sleep can affect your sperm DNA without obvious symptoms. Lifestyle factors are only a part of the story. There are medical causes many men don't realize. Several medical conditions contribute silently to male infertility, like varicocele, chronic prostatitis, blockages in the sperm pathway, or hormonal imbalances. Many men assume the fertility is related to genetic or age-related reasons, but they don't realize there are a lot of reasons for structural or inflammatory reasons for infertility. So relying completely only on semen analysis report will not give us the full story. And this is exactly why early awareness can change outcomes. Erectile dysfunction and fertility challenges are signals and not reasons to panic. Listening to your body, making small lifestyle changes, seeking timely medical help, and addressing the urological issues can significantly improve your sexual health and overall health. And if you are experiencing symptoms, do consult a urologist early, because early action makes all the difference. If this helped, like, share, and follow for more men's health insights.